Bringing your pet to the veterinarian can be such an anxiety-inducing experience for everybody, especially your furry family members, but not so here at Jefferson Animal Hospital. This is Laura Cook, staff supervisor, and Dr. Kennedy, who have low-stress techniques that you can not only help teach us, but that you implement here.
Yes, ma'am. One of the things we like to do with cats is use towels to help them feel kind of a swaddling effect to be more comfortable. And these are things you can do at home. Say you need to trim their nails, give them medications. All you do is you have a towel that's kind of thick and fuzzy, and you can wrap it around areas of what you need to get to. So if you needed to give her some medication, you've got her mouth exposed. If you need to trim some nails, you can cover her face so she doesn't see what you're doing, and you can do nails that way. So a towel can really serve a lot of purposes, and it's something that you have at home that you don't need special equipment to do. And that is our secret weapon.
Okay, so explain your secret weapon, and I wish that we had some way to let everybody smell this, but it kind of smells a little bit like a glazed donut.
Yes, yes. Feel Away is a synthetic pheromone that is something that cats associate when they are comfortable with their territory, that they feel ownership of their territory. And when you spray it on a towel, we wear it on our scrubs, it kind of gives the sense of this is an okay place, this is an okay territory, and it just kind of puts them more at ease because that smell is already there. So they don't feel like they need to rub their faces on everything and create that smell. It's already existing, so they can go ahead and relax because that message is already there for them.
So when you sprayed that on your uniform today, how long will this last?
It will last about 4 to 6 hours.
I've got a cat at home. I'm going to try this. I'll let you know what happens. Now, what about when it comes to how you transport, especially a cat, to the doctor?
They typically don't enjoy traveling in the car like a dog
No.
does. They don't want to get up and put their noses out the window. So we definitely recommend a carrier so that they can be enclosed, be safe. If you have a cat loose in the car, they can cause some distractions. Also, we recommend covering the carrier. Outside noises, motion out of the window can be disturbing for them, so kind of create a nice little hidey hole where they can be in the dark and have less noise, and that way when they get to us, they're already kind of in a good mindset before we start working with them.
Is it helpful if you have a cat who's not used to being in a crate to kind of have that out there in the home?
Absolutely. I keep my carrier out 24/7. They lay on it, they get in it, so it's not something of when I see that carrier, something bad's going to happen. It's kind of part of their environment, and if they're used to seeing it, it won't be as hard to get them to go into it.
I mean, it really is. Before we started filming, if you could have seen Ellie, I mean, she was seriously anxious, and now, I mean, so comfortable. I mean, forget low stress. This is no stress right here.
Yeah, she very, very much responds to the Feel Away, and just having a gentle hold on her. You don't need to overdo it and really kind of crank down and manhandle them. They respond to their pressure points on their bodies, and there's certain ways that you can hold them that they will just mold right into you.
And that continuing education for your people who bring in their pets, that's something that you can also teach and willingly do so.
Exactly. We've all gone through extensive training on these techniques. We didn't just figure it out and say, oh, this cat looks comfortable. And then we also can pass those techniques on to clients so that they can help their cats and their dogs feel comfortable coming into the vet before they get to us.
Well, speaking of dogs, let's switch over here to Dr. Kennedy. Dr. K, what about when it comes to your canine?
This is Diesel, and with dogs, they also sometimes get very nervous traveling in the car. And so you can do some techniques where you can get your keys out and they think, oh my gosh, we're going to the vet. And then put your keys down and not go anyway. You can do some conditioning type of things. Put them in the car and drive around the neighborhood. And then when you come to the vet, we have some other pheromone things, one called DAP, dog appeasing pheromone, that we can put on the dog, and we can put it on our uniform. But treats. They do well with treats.
Right.
So we have dogs that come in and they get right on the scale to get their weight because they want a treat. And it's very, very, very helpful to have them expect to get rewards when they come in. So we want those dogs to come in and say, oh, I'm going to get treats. I get to see the vet. And you want them to enjoy coming here and not be all anxious because we need to get a little blood sample or that we need to take an x-ray. So it's conditioning of the patients. And we work with the clients so that they know, bring your pet hungry. don't feed them when you come in. That way they're more apt to take the treat and to be happier with the treats that we give.
And last question for you both. I think a lot of us have experienced, whether it is a feline or a canine, those pets who are so anxious, and you know what I'm talking about when it comes to nail trims. Is there anything you can do at home to prepare them for that?
Get them used to just touching them, get them used to touching their feet, give treats while you're doing it. If the situation starts to be too anxious, if she's starting to get a little edgy with that, I'm going to redirect and do something that she likes. I'm not going to end on a bad experience of her having her foot held. Anything you can do to make them remember the good parts is what's going to make it easier.
Okay. Dr. K?
Same thing, right?
Mhm.
You acclimate the pets and give them lots of treats when they come in. And there's a lot of techniques that we do not muzzle our dogs if we can help it.
Sure.
And we do not muscle them down if we can help it. We want them to come in here and enjoy the visit and be able to get our blood samples and do whatever we want without them trying to get aggressive or try to bite. But like Laura said, bring them hungry, and we use lots and lots of treats. That, you know, you can do a trail of treats. You can get them to come on, get on the scale by having them treat, treat, treat,
Sure.
treat, 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 and get them right on the scale, or get up on the exam table. You know, it works very, very well.
Thank you so much, both of you, for the tips. If you want more information about Jefferson Animal Hospitals, you can just go to jeffersonanimalhospitals.com.